back in those days didn't even have college degrees. They would get demonstrator tickets. They would watch, perhaps from a long distance, how a surgery was done, and then hopefully they could apprentice somewhere before they became a physician. Johns Hopkins said you're going to know 2 languages. You're going to be proficient in French and Latin, and you're going to have a college degree. We're going to accept women. That's an interesting concept, and we're also going to find the best chairman we can find in the world to lead this medical school. So they got the Fab Four of chairman. These are the Fab Four. This is William Halsted. You may have heard of Halsted, radical mastectomy. He was one of the great surgeons of his day. Never mind, he got addicted to opium, trying it out to see if it could be a nerve blocker. He kind of overdid it. One of his students died from those experiments. But he was a great, great surgeon, and all the young surgeons in the country wanted to train with him. People like Harvey Cushing, who opened the brain, came because he wanted to be with Halsted. And this is Halsted standing. The guy that did the painting didn't like Halsted. He was offended by him for some reason. So they say he painted the face with a pigment that would fade over time. This portrait now is at Johns Hopkins. I saw it a couple of years ago. It's been restored, and Halsted's face has been framed. This is William Welch. He's key to how medical schools changed, and this is going to all relate into the humanities. William Welch had trained at Columbia, but he'd gone over to Germany and Europe, and he saw the German method, which was a lot of research incorporated into the training. So Johns Hopkins was going to be that medical school that integrated research into the clinical care on a high level. And Welch would become the dean of deans. All the deans in the country of medical schools would turn to Welch. He was the voice of medical education and the direction of medical education. And there's Sir William Osler sitting there. He's the chief of medicine. We didn't have all the specialties in those days, so you're chief of medicine, and you cover it all. Pediatrics would happen several years after Osler would leave Hopkins. And then that's Kelly. He's an obstetrician. He had his own program. He was a great surgeon himself. But those first 3 I mentioned, that really is the Fab 3, but Fab 4. Johns Hopkins was quite a different place, and as you'll see, things happened there that changed medical schools to this day. Well, the medical school didn't get built first. They built the hospital, and they ran out of money. And it turned out some of the railroad families, the daughters and wives of some of the railroad barons came up with the money to build the medical school. So when Osler arrived, he had a little bit of time. So working in the hospital, he wrote a book, Principles and Practice of Medicine. That became the textbook of medicine for 16 different editions. So Osler really was the physician's physician. He was the voice of medicine. And this guy down here, Frederick Gates, doesn't he look crusty? He happened to be Rockefeller's advisor. He's a Baptist minister. He read Osler's book, and he said, you know, there's a lot in here about new information about disease that we never knew. Osler knew it because he had been looking in the dead house for so many years. But there's very little on treatments, and he went to his boss, who was John Rockefeller, and said, you ought to start a foundation for medical research. And so that's how we got the Rockefeller Institute in New York, thanks to Gates. Another thing was happening, this guy shows up. Some people say he's kind of an addition to those 4. Abraham Flexner, that's another name. When you're interviewing for medical school, you want to know some of these names, and Flexner especially. Flexner was not a physician, but he was a school teacher in Louisville, Kentucky. And he was teaching a small school of students how to get ready to get into some of the Ivy League schools. And very rich families were bringing their children to him, and somehow he had some formula that seemed to work very well. His formula was he was teaching them critical thinking. He wasn't telling them read all of this and memorize it. He was teaching them how to think, how to learn for themselves, how to get educated. And it was working, and he did one more smart thing. He wrote a little book on it. And it got picked up by Carnegie. Remember Andrew Carnegie? It was Rockefeller and Carnegie. They were kind of vying for who could build a foundation or who could buy each other out. So Carnegie, he got involved and said, let's get involved in medical education. let's do a study of medical schools in this country, kind of a baseline, and let's find somebody who could go do that study and look at all these medical schools in the country. And Flexner was picked, and he went all over the country. He looked like Darth Vader in those days. There's a look at him, kind of imposing. He was imposing. He would walk into a medical school. He all did this in 1 year. He went to Canada and U.S. medical schools, over 200 of them. He might be only there for 3 or 4 hours, but he could sniff in the air when he walked in and tell if they had cadavers. He would ask the student, not a medical student, not a faculty member, where's your microscopes? Some of them say, we've never had a microscope. We've never had a cadaver. We don't touch patients. He would go back and write up his summaries of medical schools, and everything he was basing these schools against was Johns Hopkins. That was his gold standard. And as a result of that, medical schools in this country, and the report came out in 1910, really went through the ringer. If there were 200, we went down to about 100 very quickly. He said in his report, for many of them, I don't even know why they call themselves a medical school. They should shut down immediately. So here's a guy without an MD degree, and he is now in demand by medical schools all over the country. How can we make ourselves better? Which chairman of surgery can you recommend who should be our dean? There's Welch again. He's right there with Flexner. He's the dean of Johns Hopkins. He's also reading the report and advising. They kind of work closely together. And really revolutionized medical schools and brought them more up to the standards of Johns Hopkins. So what did Osler have to say? This is where we're going to get into the doctor-patient relationship. Osler always insisted that the practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally with your head. He would tell his students, if you don't understand what that means, you need to get up and leave right now. The patient would always come first. And I'm right now writing a biography of Red Duke, who passed away about a year ago. And talking with Red, who's founder of Life Flight over here at Herman, there's a lot of Osler in Red, and I remember a story I picked up the other day from one of the nurses that worked with Red for 16 years. She is very Osler-like. Red would find a new surgical resident his first day coming into surgery with Red, and Red would say, who's the most important person in this room? Now, a lot of these surgeons kind of fell for the trap. They said, well, you are Dr. Duke, you're the surgeon. And then Duke would proceed for 30 minutes to ream out this student, the patient's the most important person. That's exactly what Osler would say. And this nurse said, I hid under my mask as he reamed out these students, and he would wait for every new surgical student to come to ask that question. So if you ever get in surgery over there, someone's probably picked up Red's tricks, so you know the answer. Osler was all about the humanities. He understood that it's an art and a science. Listening to the patient, caring for the patient, the whole thing of hands-on, using your heart and your mind. So he basically, in his own way, said it's like twin berries on a stem. You can't really separate the two. And he fought very hard to make sure that happened around him. He wanted everyone to learn in the wards. He didn't want you being in large lecture halls, very much Flexner-like. He didn't want you to just be in a lecture hall to hear about it. He wanted you to be with the patient and with the physician. There were movements at that time to, Flexner did good in terms of perhaps improving the quality of medical schools and getting a massive change taking place more along the Johns Hopkins model. But you could also argue that Flexner also created this new bent in terms of moving towards research. And if research moves too fast and the patient falls behind, then you have a problem. So Osler was not at all for the full-time physician on the faculty, for clinicians to leave and get on the payroll of a medical school and suddenly be in a research lab more than a patient contact. He didn't feel like they could really teach medicine unless they were at the bedside of the patient. So Osler fought any of these kind of moves will take the patient out of the equation. So I mean, when you think of him with an electronic medical record, I think he would insist it's a calling. You can't separate the listening, the touching, I wanted to read something a friend of mine, Dr. Wolf, we have this same friend, Dr. Herb Fred, trained at Baylor. He's spent 60-something years in medicine. He's still around. I think he's retired. He's a curmudgeon, and he's proud of it because he doesn't like change. And here's what he has to say. He's also an Oslerian, and I think if Osler was here today, he would be saying the same words that Dr. Fred's saying. Dr. Fred published a paper, Medicine on the Brink, 62 years on the front line. I just pulled a few lines from that paper. Fred says, Osler's day, you used your 5 senses. Medicine was the calling. In the 70s and 80s came CTs, MRI, and more. This high-tech diagnostic approach shifted focus from the patient to the laboratory and sacrificed to a large extent the very core of doctoring, humanism. You heard that in Dr. Barron's talk. Over-reliance on technologic advances crippled physicians' use of their minds and 5 sensory faculties to make diagnosis. It depersonalized the patient-doctor relationship and essentially eliminated the individuality of patient care. And then he also said, in skipping or curtailing the history-taking and physical examination, the high-tech approach weakened the patient-doctor bond or prevented it from ever forming. It also promoted laziness, both physical and mental. Characteristic of the mental inertia was the inability or unwillingness to think for oneself and reflexive critical thinking. This herd mentality adversely affected all aspects of patient care, especially correct decision-making and effective communication. It also dampened requisite curiosity and impeded self-education. The overall result was inarguable: the inappropriate, indiscriminate, and inexcusable use of technology. So when we talk about the art and science, it is a delicate balance. You can't go just to technology. Then you end up with scenarios like you might have heard, where a physician just has a smart tablet and gets the data and tells someone else, you go talk to the patient, tell them what we're going to do. Osler would not have stood for that. So I want to tie Osler to where we are today. This is Dr. McGovern. In the middle is Dr. Wilbert Davison. Does anybody know what medical school he founded in 1931? Durham. He founded Duke. He's the first dean of Duke. Now, Davison's story is interesting. He was a son of a Methodist minister. He was a pediatrician. All these great physicians seem to have connections to fathers who were ministers. Davison went to Princeton. Anybody know who his president might have been in those many years ago? Woodrow Wilson was his president. Wilson was getting ready to run for president. And in 1913, Wilbert Davison became a Rhodes Scholar, and he went to Oxford University because Osler in 1905 was asked to come over to Oxford and be the Regius Professor. And so Davison would train with Osler. And Davison would follow Osler and listen to Osler. And when he had the opportunity to found Duke Medical School, he said, I'm going to do everything Osler would do. And so he started with a library of books. He took the students and put them on the wards immediately. They weren't going to sit in lecture halls for 2 or 3 years and never see a patient. And he basically followed Osler's ideals about the calling and what the patient relationship should be. In 1939, John P. McGovern graduates from Woodrow Wilson High School. As a historian, I'm always interested in all these connections. 1939, and he goes to Duke as an undergraduate, and his dream is to get across the hill to the medical school someday and become a medical student. Duke was only, about 10 years old at the time when he arrived. And he goes over to Davison's office to meet him for the first time, and McGovern didn't know a thing about Osler. Well, as soon as he gets in Davison's office, all he sees are pictures of Sir William Osler. And for 1 hour, Davison tells McGovern all the stories of Osler and what it was like training with him and working with him, how Osler, all the things Osler believed in, the patient first. And McGovern, at the end of that 1 hour, said, well, how can I see about interviewing for this school? And Davison said, well, you've just been accepted. And that's how John P. McGovern got into medical school. and became an Oslerian, because if you follow Davison around, which he did, and McGovern would become a pediatrician and an allergist, you're going to be following Osler. There's a saying, you shake the hand of the hand that shook Osler's. So this is how the connection works, and when I'm teaching our medical students, many of them walk through the door of the McGovern Medical School, or they walk into the McGovern Center for Humanities and Ethics, and they have no clue of the direct connection there is. And when we talk about our medical students who are humanities students, who are just like you, they care about being the best they can be. They care about those little principles, that it's not just about knowing the knowledge of medicine, but it's also knowing the classics. It's about being interested in literature. It's about being interested in everything your patient might be interested in, because you're going to listen to your patient. You're going to be able to converse with patients no matter whether they're from Harvard or Boston, or whether they're farmers from Texas. And this is the way Dr. McGovern decided he wanted to run his allergy practice. And I know when he had his allergy practice down here on Brompton and Holcomb, when he built that building in the 70s, he put frosted glass so patients that were waiting could see the activity of the physicians back there. They weren't just out to lunch, they were working. And the nurses I would talk to that worked with Dr. McGovern, they said, if a patient asks you a question, you never said, I don't know the answer. You said, I don't know the answer now, but I will be back with the answer very shortly. The patient would always come first. So out of McGovern's interest, in 69 he started the American Osler Society, not to worship Sir William Osler. Osler had his own faults and issues. When he went off to Oxford, he made a speech to the party of Johns Hopkins saying that if you're over 65, you probably can't contribute much anymore professionally, and papers picked up on that. And there's a word in the dictionary, Oslerized, that's sort of like euphanizing anyone over 65. They misinterpreted what he was saying, but it doesn't matter. It's how it's interpreted in the media, it's how the public perceives it. So Osler kind of ran off to Oxford for that. But Dr. McGovern, when he came to Houston in 1956, he wanted clinics, and he wanted to help Texas Children's. He had a Baylor appointment and a UT appointment. He wanted to help these institutions develop their allergy immunology programs, but he also cared very deeply about Osler principles in care. And people like me, or anyone that came along working with John P. McGovern, we're going to get, for beginner, 1 hour at least about Osler and the principles of patient-centered care. And we have a McGovern Center for Humanities, Ethics, and Ethics at our medical school. I think Dr. Nash is speaking. There he is. He used to be with us over there, and I here at U of H. But it's a wonderful program. We have over 100 students in this program. And when I ask the students, why did you get into this humanities program? It's always the answer I like to hear. It's, if I'm going to be the best doctor I can be, I want to be the best person I can be. I want to be well-rounded. And I want to care about my patients, spend the time I need. And of course, Dr. McGovern, long before we had a program here at the UT Medical School, back in, I guess it was in the early 70s, he and Chester Burns, who's no longer with us, but they started McGovern Academy of Oslerian Medicine, a very strong Oslerian program down there to teach students about Osler and patient-centered care, to talk about the humanities, ethics, all of these issues. So we have 2 wonderful programs, and Dr. McGovern funded many, many other programs all around the country. So I'm proud I was able to work with him, and I'm glad I read the books on Osler he gave me back then. So I think I've used up about my 30 minutes. I'd be happy to take questions. You may have questions, but if nothing else, you know a little bit more about Osler. And I can tell you the students from our humanities program, when they go do their residency interviews, one of the first things they're asked about is the humanities program, because it's unique, it's different. And when you can talk about patient-centered care, the calling of medicine, and you can talk about Osler and putting patients first, and you can say things like, I'm here to treat a person, not a disease. These are things that matter. They matter to all physicians. And unfortunately, we have these tugs of electronic medical records, and we have these demands on physicians to see more patients faster. And you have to find ways to resist them, and one of the ways, at least, is to do more training in humanities and not let that happen as much as possible. So any questions? Yes?
If there was one book by Osler that should be our gateway into Osler's
Yes.
patient-centered care, which one would it be?
Read Michael Bliss, he's a Canadian, and he did A Life in Medicine, Sir William Osler, A Life in Medicine, I believe. This Michael Bliss and Osler, Google that. It's a wonderful book. Michael Bliss is in the American Osler Society. He's a highly recognized Canadian historian, and he did a terrific book. Now, the first biography that was done on Osler was Harvey Cushing, who would come to train with Halstead. Cushing was a smart little fellow when he came. He and his roommate rented the house next to Osler's, and Lady Osler eventually liked them so much, she said, just cut a hole in the fence and come over anytime you want. So they had full access to Osler's library. Cushing would go on to open the box, the brain, and if you go up to Yale, there's a wonderful Cushing exhibit, and all of Cushing's books, Cushing became a bibliophile collecting rare books. All of those are at Yale now, the Yale Medical School. Dr. McGovern donated much of his rare book collection to our Texas Medical Center library. Davidson did the same for Duke. You know, Osler would say to his students, the last 10 minutes of each day, you need to commune with the saints of history. In other words, we'd sit down and read, whether it's from the classics or whatever. It's hard to read Osler's speeches because he pulls in everything, mythology and things. So there's some wonderful books. One was done by Hinahara, Annotations. That's the one I was helping Dr. McGovern with. In Annotations, you can read Osler's famous addresses to students and others, and you can get all the footnotes of what he's talking about when he drops in all this terminology. The second half of Osler's life was about the profession. He was the great physician, he was the physician's physician, but when he got to Oxford, he was the physician who basically said, here's what we need to be thinking about as a profession of medicine. He thought on the big scale, belonging to organizations. So he would be very, very interested in how the AMA has dealt with managed care and those kinds of issues. He was all about belonging, and he was all about the qualities that are now what we talk about, professionalism. If I have a couple of minutes, I'll just mention a little bit about professionalism because it pulls from the qualities of Osler. I asked a student one day, what is professionalism? Medical student, and he said, this is a quote, "Dude, you must be talking about dress code." Professionalism in medicine now is being measured by accreditation groups, so it's a very important area, and that's why curricula are being redone so we can do more of this. And here's some of the things Osler would say, and this is just part of what professionalism, Herb Swift's in the American Osler Society. I really like the way he's broken out these attributes. You want to subordinate your self-interest to the interest of others. That's in the Hippocratic Oath. That's kind of a given when you graduate from medical school. High ethical standards, you know. Being part of a humanities program helps you understand the basics of ethics and how to make these decisions that are always going to seem to be in a gray area. But at least you'll have some foundation to how to make better decisions. Respond to societal needs. You know, when I was at medical school helping after Katrina, we were down at George R. Brown and at the Astrodome helping all the people that came in from New Orleans. I see pictures of Osler's home at Oxford, 13 Lawn Garden. Dr. McGovern bought that home for the college there. It's now a center for learning, an Oslerian program. Osler had his home full of shoes and things during World War I. He was collecting things to send over to families, especially the academic families that had lost their homes and things. Osler was out saying in the press, to the Germans, don't kill the cows, the children need milk. Core humanistic values, these are kind of basic tenets. Accountability, this is big on Osler, and it's big on everything you should be doing. Osler belonged to professional organizations because he said we tend to get egos and we need to keep ourselves honest. We need to be presenting what we're doing in front of our peers. And Osler belonged to organizations. Anywhere he was in the country, if he saw something, an institution that needed a library, he would write his friends or Billings at the National Library of Medicine, can you send them this? They need it over here. He was always trying to help Demonstrate a continuing commitment to excellence, a commitment to scholarship and advancing the field. You need to be publishing what you're doing. Davison said, I've got all of his letters to McGovern. He said he was driving Sir William Osler to a place that they had to go check on some patients, and Osler had a stack of journals in his lap, and Davison's driving. It's like a 50-minute drive across England, and Osler's going through these journals like this. Just when they get there, Osler pulls 3 out and says, Davison, there's 3 articles that are going to be of interest to you. He can digest medical information that fast. And reflect. This is something we do in our humanities programs, and that is, at the end of the day, let's talk about what we've learned. I don't know if you're doing journals. We do journaling so that in the 3rd year, all of our medical students write about their experiences, and reflection is very important. Osler wasn't given latchkeys for fun. That was a place where they could gather and reflect, and he always had a crowd of people just about every night. They were not just learning history, they were reflecting on their own attitudes and thoughts and decisions they had made and how they might go differently. So all of these things go into professionalism in medicine. So we can learn a lot from Osler there. He exhibited all these qualities. So thank you very much.
We're going to be taking a 3 to 5 minute break in preparation for the next presentation.
So in the value section, that's a minute at rest. And news. Are you? I knew my dad. So I talked to my dad. And I didn't